Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're not announcing any additional deaths due to COVID-19. Our current 5-day COVID-19 test positivity rate is 4.2% provincially and 3.3% in Winnipeg. As of 9:30 a.m. This morning, 53 new cases of the virus have been identified, bringing our total lab-confirmed cases to 33,975. Manitoba had been screening for variants since the beginning of this pandemic, and at that point, screening was done on samples that were selected due to concerning traits, either part of an outbreak or recent travel, and some random assortment of samples. Earlier this year, we introduced a screening process to look at a few of the variants of concern, including the B117 variant, which was first identified in the UK, the B135 variant first identified in South Africa, and the P1 variant first identified in Brazil. For our screening process for the B117 and B135 one, our screening process is quite precise. Right now, 100% of our VOC screen positive samples are being confirmed as a variant of concern by sequencing. Sequencing is, of course, a much more complex and time-consuming component of detection of these variants. And so not every variant of concern screen positive sample requires sequencing anymore. To date, we have only been reporting sequence positive VOCs, but because our manner of screening has become so precise, Manitoba will now start to report on all samples that screen positive as a variant of concern. This is being done in other provinces such as Ontario and Alberta. That's why today we're going to see a jump in the variant of concern cases, because now we've included ones that have just screened positive that would have been pending sequencing in the past. Like we mentioned, not all samples are required for sequencing, and especially now that our screens are so precise. But if somebody had been a household contact of someone who is a definite variant of concern, there is no need to sequence that sample. We already know they're a close contact to a variant of concern, so they would be a variant of concern. So today's samples includes both screen samples and sequence samples, and going forward we'll be reporting on both. One day last week, up to a third of our cases had screened positive for B117. And this is showing us that the B117 strain, like many other jurisdictions in Canada, is becoming the predominant strain. As these numbers get higher and higher, the value of sequencing, the value of screening become less and less, because we will know what the predominant variant is. But right now, we know these are here. We can see in other jurisdictions they're leading to increase in transmission, an increase in hospitalizations at younger ages, and increased severity. So this is why we need to ensure we are staying on guard against the transmission of the virus, following the public health guidelines, so we can continue to reduce the transmission. And along those lines, we know that spring break is here, with the Easter shortly behind. There's a time when Manitobans would often gather in large groups indoors, and as well as a lot of non-essential travel normally occurs. So of course at this point we are strongly discouraging that. The travel self-isolation orders are in effect for people who do travel for non-essential reasons. We have the public health orders for gatherings in place. You know, I know this is the time where many of us want to celebrate as per the usual manner, but we can see with the growing numbers of variants of concern, seeing what's happening around us, we just can't do that at this point. We saw where that got us over Thanksgiving, and we just can't be in that place again as we continue to roll out our vaccines. And really, that's the race we're in right now. So we need to reduce amount of close contacts, and so that means gatherings. And we know that indoor prolonged gatherings are most at risk. Outdoors is less risky. We need people to stay home when they're ill, but we have to be focused. We can't let up at this time, so that we can continue to keep our numbers down as we face the threat of the variants of concern. We'll soon be able to resume those type of celebrations. Pandemics all have an end, and this one is no different. And we have a tool now to manage this pandemic quicker, and that is a vaccine, which we should all be optimistic about. But right now we need to be focused on keeping these numbers down. So again, thanks to all Manitobans, and I'm going to pass it over to Dr. Reimer for her comments.
Thank you. Good afternoon. I'm Dr. Jos Reimer, the medical lead for Manitoba's Vaccine Implementation Task Force. I wanted to join Dr. Roussin today to talk about AstraZeneca and some of the new information that we have learned regarding some of the side effects occurring in Europe. Despite the findings that there was no increased risk of blood clots overall related to AstraZeneca in Europe, a rare but very serious side effect has been seen primarily in young women in Europe. So out of an abundance of caution, Manitoba will be recommending that these vaccines only be used in people who are 55 and older at this time. I do want to say that this is a pause while we wait for more information to better understand what we are seeing in Europe. This is an important and evidence-based change that Manitoba is putting in place today. We have to respond to what we know when we know it in this vaccine campaign, which does sometimes mean adjusting our plans in real time. This means in Manitoba, AstraZeneca or Covishield vaccines should be used for people who are 55 to 64, and we are implementing this change effective immediately. In Manitoba, these vaccines are currently available through medical clinics and pharmacies. We are speaking with those partners today so that they can adjust their vaccine plans, which means that anyone under the age of 55 will be contacted to cancel their appointment. I know that this could be very disappointing news for people who were expecting to receive the vaccine. We want this to be done in the safest way possible. If you have already received the vaccine, the AstraZeneca or Covishield vaccine, it's likely that you have questions. You may have concerns related to this announcement. The increase in this rare type of serious blood clot affects somewhere around 1 in 100,000 to 1 in a million people who receive this vaccine. Typically, the symptoms happen 4 to 20 days after immunization. And the symptoms can mirror the symptoms of a stroke or a heart attack. Now, whether or not you've had the vaccine, if you're having symptoms that look like a stroke or a heart attack, you should seek immediate medical attention. But to be clear, if you have had the vaccine, we do want you as well to seek medical attention if you experience those severe symptoms. I do want to be clear that to date, we have not seen any of these cases in Manitoba, nor in Canada. We have given at least 14,000 out of our 18,000 AstraZeneca doses in Manitoba. We have an excellent monitoring system in place for adverse events following immunization, which is one of the critical safeguards in our immunization campaign. And this is an example of how that works when it's working well. Because we have this very thorough monitoring system in place, as well as the one that's in Europe, we were able to detect this rare but increased risk of this severe side effect. At this time, the benefits of the vaccine for people who are 55 to 64 still outweigh the risks, even those that I just described, because the serious side effect has been appearing more often in younger people. And at the same time, for people who are older than 55, the risk of COVID infection goes up substantially. We know that when people are hospitalized due to COVID, they have a very high risk of having a blood clot. So the higher the risk is related to COVID, the more beneficial that vaccine becomes, even if there's a risk of blood clots associated with it. So we're going to continue to follow the science and the evidence to guide our next steps. This is very rapidly changing. These reports began about 10 days ago, and so the analysis has been quick, but it's also been thorough. And so I know that what I tell you today may change by the time we have our next press conference on Wednesday, but I want Manitobans to be as up to date as we are. I'm committed to providing the information in Manitoba as soon as I have it. I also wanted to speak briefly about the experience that people had at our Winnipeg Supersite over the weekend. Beginning on Friday, it became clear that there were a number of challenges that resulted in people waiting a significant amount of time for their appointments. This led to lineups and frustration. This is not the experience we wanted people to have. So for everyone who waited on Friday, we are sorry. Everyone who was there was immunized. Everyone who stayed was immunized. No appointments were canceled, and we finished the clinic by about 9:30 p.m. on Friday. Since then, we've taken a number of steps to improve our staffing, improve our patient flow, and the situation did stabilize and improve over the weekend. As of this morning, I'm told that the wait times for people at RBC are very low, around 10 to 20 minutes. The entire team pulled together with the support of a number of volunteers, as well as the support from the City of Winnipeg. And there were many others as well who came together to make improvements over the weekend. That was really important, and we're still making adjustments to make the entire process smoother for people coming in to be immunized. Before we go to questions, I just also want to note that we're hearing about some significant changes to the weather that may be coming to various places across the province starting later today. If you do have an appointment to be immunized, but you're not able to attend due to weather, you can contact our call schedule to reschedule any appointments made by phone or online. And with that, we will take questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CityNews, Jonas.
Good afternoon, folks. Dr. Reimer, Dr. Roussin, maybe I'll begin with you this afternoon on the variants. You said last week up to about a third, I believe, of all tests have been screened for the variants. Maybe a thought on this growth and, looking at Ontario and what's happening there, your thoughts on what can happen here.
Well, this is the concern. We know that the B117 variant is much more infectious, and a lot of evidence showing it's more severe, some more hospitalizations, longer hospitalizations, younger people being admitted. So it's definitely a concern. It's why we had more aggressive case and contact investigation. It's why we still have our public health measures. It's why we weren't able to proceed with a number of the proposed openings that we had suggested. It's all in regard to the risk of that variant. So we need to keep these numbers down. We need to be aware that this variant is much more infectious. And then we have to see to take a look in the jurisdictions around us, the difficulties they're seeing because of this variant.
Dr. Reimer, one for you on AstraZeneca. Again, I think, just maybe confirm with folks that have got the AstraZeneca vaccine that, again, you said 1 in a million risk, I believe was your number?
Well, as I said, so this is a very rare subtype, one specific type of blood clot that seems to be in response to AstraZeneca specifically. So for people who are at higher risk of other blood clots, this specific event doesn't appear to be something that they need to be any more concerned about than anyone else. We don't know yet exactly how common this side effect is. We're hearing from Europe that it could be somewhere around 1 per 100,000 doses, but because the data is so new, that's why we want to pause with younger people so that we have that chance to collect better data and have a better understanding of exactly what the risks are. We want this vaccine program to be safe, And while, we still believe that probably the benefits for all ages outweigh the risks, I'm not comfortable with probably. I want to see more data coming out of Europe so that I know exactly what that risk-benefit analysis is.
From CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, over the weekend there's been quite a drop in Winnipeg cases. Can you explain why?
Well, there isn't a single explanation for that. There's a number of potential explanations. Like we mentioned, we've been doing quite aggressive case and contact management. We've continued to leave many of our public health restrictions in place while relaxing, very few of them with this last order. So we'll have to continue to follow the epidemiology. It's certainly, what we're certainly looking for. We don't want to see the continued rise, but this is just a few days. We can't put much weight on it. We have to remain vigilant as we move forward.
Thanks. And Dr. Reimer, how has personal scheduling played a role in people getting their vaccines, things like arranging transportation or, as you mentioned, adverse weather?
Sorry, can you say the beginning of that question one more time?
How has personal scheduling played a role in people getting their vaccines?
I mean, I imagine people have to always weigh out their personal schedules with any sort of healthcare service. So certainly if you call the call center, they will work through a number of different date and time opportunities to attend one of the pop-ups or super sites. And the scheduling related to pharmacies and physicians would be individually tailored to whatever that clinic or pharmacy can offer. But I think we've all experienced the challenges around trying to book appointments for a variety of different healthcare interventions. And so, Manitoba, as the vaccine team, we certainly recognize that and are trying to provide people with flexibility by being open evenings and weekends as well as during the day to allow for a variety of different schedules to be accommodated.
From the Winnipeg Free Press, Katie.
Hi, good afternoon. Dr. Reimer, can you tell us how will pausing the AstraZeneca vaccine for people under 55 affect the timelines that have already been announced by the province to vaccinate all Manitobans by June?
Yeah, that's a tough question to answer because it depends on how long the pause goes on. We're waiting to see more information. If this were to be a short-term pause, I would expect it would have no impact on the overall rollout. Certainly, there's still many people over the age of 55 who have not been immunized, and so being able to shift those doses to other folks who are over the age of 55 in the long term, if it's not a long pause, wouldn't have any impact because it just would shift where the doses go now. We don't have any intention of holding back on the vaccines overall at this point, so we'll still be providing all of the doses that come in. And so, we'll have to wait and see if we continue to pause on this, or if we get good safety data coming out of Europe or even out of North America that allows us to open back up to younger ages.
Thank you. Dr. Roussin, do you have any information on the variants of concern spreading outdoors in Manitoba? And can we expect changes to the outdoor gathering rules because of the increased risk of transmission?
So we don't have anything, Manitoba specific on that. We do know that the variants of concern are much more infectious than wild-type virus that we saw earlier on in our first and second wave. But we still know that outdoor exposures are less risky than indoor. We have the indoor, crowded, poor ventilation, prolonged contact. Those are the real at-risk areas. So right now we'd still be encouraging outdoor activities more than anything. We do want to keep those numbers, those group sizes relatively low, but certainly the outdoor contact is much less risky than indoor.
From Global News, Brittany.
Good afternoon, Brittany from Global News. Dr. Reimer, my first question is for you. We did see that major influx of doses available last week, increase in daily appointments. Obviously, the system got tested on Friday and there were issues. So with 123,000 doses coming this week, albeit some of it AstraZeneca, how are Manitobans supposed to be confident that our system is going to be able to continue to handle this and do, starting somewhere upwards towards that daily max doses a day?
Yeah, as I mentioned on Friday, the experience was not what we wanted for Manitobans. And the team really came together on the weekend and spent a lot of time adjusting the processes, adjusting the staffing, and things were better on Saturday than they were on Friday. And I'm told they were even better on Sunday than they were on Saturday. So there was a lot of things that we learned about what happens when you test the system and start to ramp up to those high numbers. And while Friday was not the way we wanted it to go, those lessons have been implemented and things are going much better today. And as I mentioned, today's wait time is more like 10 to 20 minutes. So, we're always going to see changes here and there, and there's going to be times where we face challenges, but overall, I have a lot of confidence in our operations team. They stepped up and identified what the issues were on the weekend to try to give Manitobans that quality experience that everyone on the task force wants them to have.
Thank you. And now that we're starting to see significant vaccine deliveries happening this week and into the future, how soon are we going to be starting to get anywhere near that 20,000 a day max that you guys have spoken about?
I don't have the exact numbers that the federal government have provided us in front of me, so I can't say exactly when we're going to hit 20,000, but certainly we look forward to receiving more doses and to having more opportunities to provide them to Manitobans at our super sites, at our pop-up clinics. And so I do expect that in April we're going to see a slow and steady increase, but potentially still waiting until later in April, potentially May, before we get to those really high numbers that we're looking forward to receiving.
From the Brandon Sun, Colin.
Good afternoon. Dr. Reimer, will there be any sort of effort to make sure that those with appointments that are getting canceled for AstraZeneca, make sure they'll be rebooked at a later date or give them priority for another vaccine?
Yeah, so it's a really difficult situation trying to cancel appointments. You never want to have to do that. And I'm certain that there are Manitobans who are feeling very disappointed hearing this news. I just want to reassure them that we want to make sure that things are safe for them. We are continuing to decrease the age eligibility for the mRNA vaccines for Pfizer and Moderna. So these folks we hope to reach very soon. But in the meantime, we want to be confident that what we're providing them is more beneficial than it is risky. Every time we do anything in healthcare or even anything we do in life, there's always potential risks associated with it. But we really want to be confident that this vaccine offers more benefits than it does risks to people who are under 55. So, while I'm really disappointed to have to tell Manitobans that some of these appointments might be canceled, we want to be able to hopefully tell them in the future that we have other vaccines available to them, or that we've learned that this vaccine is indeed beneficial and not overly risky for them. And we're going to be working hard as the medical team to analyze the science as it comes in so we can have that message ready.
The other thing I was wondering about is we've noticed something over the past couple of weeks here in Brandon where we have people complaining to us that they can't get appointments at the Keystone Supersite they're told they're a month out, and then we reach out to comms people and they say there's no problem, but we keep getting complaints, and then it seems like appointments open, but then very quickly we're getting complaints again that there aren't any appointments left. Do you know what's going on at the Keystone Supersite in terms of booking? Because it seems like there's a lot of people in our region who are frustrated by the lack of access to appointments.
So our goal is to book appointments around 2 to 3 weeks in the future, but no more than 4 weeks. So if we hit that 4-week mark, we don't book any more appointments because we don't want to be pushing that far into the future where supply becomes less reliable. And so if people are hearing that there aren't appointments, it likely means that we filled up to 4 weeks. How we organize our supply for each supersite is on initially a per capita basis. It's then up to Manitobans regarding how many people who are eligible actually call and book those appointments. So our initial estimates were to provide Prairie Mountain with the same proportion of doses that would meet the proportion of eligible people in that region. At the beginning of the vaccine campaign, Prairie Mountain had a lower uptake. So we were actually filling up in Winnipeg while having lots of appointments open at Keystone. In the last couple of weeks, we've seen a reverse of that, where people in Prairie Mountain are signing up and showing a lot of eagerness to get immunized. And so we're going to continue to fine-tune things and try to respond not just to how many people there are in the region, but also what's the demand in that region, so that we can ensure that people who want to be vaccinated have easy access to a vaccine. And then in those regions where there's less uptake, that we have an opportunity to reach out to those regions and try to work with the communities to address what the concerns may be, and make sure that we're identifying any barriers and helping to reduce any hesitancy we might see in those regions. So as far as I know right now, we are accepting appointments at all of our sites, but I do recognize that that can change on a day-by-day basis, because most days we open up new appointments. And so if everybody in the region is very eager, they could fill up quickly. And for other regions, sometimes they're slower to fill up. But our team is working very hard to adjust beyond the per capita to try to predict where the greatest uptake is going to be.
From CJOB, Will.
Hi, good afternoon to you both. Dr. Reimer, in regards to the AstraZeneca development, what does this mean for those under 55 who have already received their first shot of the vaccine in regards to second dose appointments?
That's a great question. So for second dose appointments, we still don't know at this point when we'll start doing second doses for Manitobans. Our goal, again, if the science continues to support it, would be to get a first dose into all adult Manitobans before moving on to second doses. So that buys us a little bit of time to learn more about AstraZeneca before having to make that decision about dose 2 for people who received dose 1. In regards to the risks related to the blood clot specifically for people who have already received AstraZeneca, I want to reassure Manitobans that it is still very rare. We have not, and we do not anticipate that we're going to see any cases in Manitoba, but we also want to keep it that way. And so I do want to share with Manitobans that if you have received the AstraZeneca vaccine between 4 to 20 days ago, and you have any symptoms that look like a stroke or a heart attack, so that could be things like a severe headache that doesn't go away, seizure, difficulty moving, severe chest pain or shortness of breath, anything like that, I would strongly encourage you to seek immediate medical attention and let them know that you received the vaccine recently as well.
Okay, thank you. And I appreciate this is all unfolding right now, but going back to what you said earlier, what information are you waiting to receive out of Europe before you're comfortable reversing today's decision? Again, talking about AstraZeneca.
Yeah, one of the most important pieces of information that we want is the frequency that this is occurring. So because it's only been recently identified, they're only starting to really analyze the different cases. And so some of the individual cases that they've found will turn out not to be the same thing or not to be due to the vaccine. And they'll also probably discover new ones that hadn't originally been identified. And so we want more confidence about how likely this event is to occur after AstraZeneca. And as well, we want to know a bit more about what are the outcomes that people experience, as well as what risk factors might be there. Right now, the scientists that we talked to in Europe couldn't tell us very much about the individuals who experienced these blood clots. So we don't know if there's some particular factor about those individuals that put them at higher risk. It does not appear to be the same risk factors as for other blood clots. And so if we were able, say, to find out how frequent it is, how severe the outcomes are with more predictability, as well as who's at highest risk, that would allow us to tailor our program to ensure that we are providing the vaccine to people where the risk of COVID is higher than the risk of the vaccine, but that we also can offer an alternative to people where it wouldn't be a good match. And it's very difficult to predict how quickly that information is going to come. I know the UK is trying to do some historical review as well to see if they had cases that they hadn't originally recognized. This is a new condition. This is not something we've seen before. And so this is the world learning together. We're just really thankful that it's so incredibly rare. The downside of it being so incredibly rare is it's difficult to study when it's that rare. But the upside is certainly what we want in that it's not occurring in very many people.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Dr. Reimer, I guess I'm trying to understand. So we're canceling appointments for people under 55 for the AZ vaccine. That vaccine has been prioritized for people with a higher risk of severe outcomes. So I guess I'm trying to understand, and you kind of just said it in your last answer there. What is the risk of not vaccinating those people, from 18 to 55? Like, have you weighed the risk between both of those, between the rarity of this blood clot and the chance of these people, contracting COVID and having a severe outcome?
Yeah, that's a great question. So we did look at the population level to see what was the risk or the frequency that people who were 20 to 49, just based on those were the age limits that we had available in our data set. We looked at the frequency at which they were experiencing severe outcomes related to COVID, whether that's hospitalization, ICU admission, or death. And compared that to the estimates that we're seeing for this rare condition. And when we looked at the younger population, we saw an overlap between the more common estimates of how common this condition is with the highest risks associated with COVID. So because those two were overlapping, that made us want to take a pause so that we could have a better understanding of exactly how those two risks and benefits weighed out against each other. So what I can say right now is that if we're assuming the worst for the AstraZeneca, then the risk associated with these rare blood clots is high enough that for someone who's young and healthy, it might be too high to be beneficial as far as how frequently they would experience a severe outcome of COVID. But we also know that we don't have all of the data yet. This is a very new condition, and we're still learning together globally. And so we're certainly hopeful that the information that we get out of Europe shows us that those most extreme estimates are not accurate, and that we find that it's actually more rare than the worst case scenario. But until we know that, we don't want to give somebody a vaccine that we're not extremely confident is more beneficial than not vaccinating.
Thank you for that. I'm switching a bit of gears here. The police officers in the Winnipeg Police Service, they're calling again for them to be, essential workers or be given priority in terms of vaccine. Has that been looked at all? What is the response to the police chief?
Yeah, so we have done an analysis of a variety of different categories of essential workers. And when we made initial decisions about prioritization, we looked at who was at the highest risk of experiencing severe outcomes, and who do we need to be in place in order to take care of people experiencing those severe outcomes related to COVID. And so that's why we did the age-based approach plus healthcare workers. It was essential that we make sure our healthcare system can be there to care for people who have COVID, but also that we looked at exactly who it was who was ending up in the hospital or at highest risk of dying. And thankfully, for most types of essential workers, we're not seeing increases in hospitalization or death. Whether it's police or teachers or hydro workers or water treatment plant workers, I mean, these are all essential workforces that we are really proud to have seen how they've responded during the pandemic and continue to go to work despite being put at risk when they're working with other people every day, sometimes in uncontrolled situations. But if they are not the people who are experiencing hospitalization or death, you know, we want to make sure that while acknowledging how wonderful the job is that they've done, we want to use this life-saving intervention to save lives. And so we need to prioritize the people whose lives are at highest risk. So to all essential workers, you know, I think everybody on the vaccine task force and in public health wants to thank you for all the work that you've done that allows us to get this vaccine to people who are at the highest risk of experiencing those severe outcomes.
From CBC Manitoba, Bart.
Hi, Dr. Reimer. On Saturday, according to your records posted online, only 798 doses were administered. That's the lowest single day that we've seen in weeks or months. What happened on Saturday?
I don't have those numbers in front of me. That doesn't sound like the numbers that I heard about on Saturday. I was at the RBC Centre myself and saw what appeared to be a lot more people than that coming through. So I think I would have to talk to our logistics team and get a more thorough answer back to you because I don't have the numbers in front of me.
All right, then. Dr. Roussin, a couple of weeks ago, you theorized that with the vaccinations taking place, the mortality or morbidity rates or fatality rates with COVID per case in Manitoba would decline. What do we know so far, latest, as of how many hundred COVID cases are resulting in a severe effect like hospitalization or death now?
Yeah, it's still early on. You know, the vaccine's been rolling out as quick as we get it, but we still have relatively few Manitobans vaccinated at this point, and so it's too early to necessarily comment on hospitalization rates of those. You know, since we began vaccinating, you know, I think that's the overall intent of the vaccine rollout. You know, there's no other reason for having it, as we want to diminish the amount of people who are having severe outcomes related to this virus. So right now we're not, we don't have enough data to be able to provide specific numbers on that. We do know what's threatening that is that the variants of concern appear to be themselves have higher hospitalization rates, longer hospitalization stays, and younger people being admitted to hospital. So we'll have to see how that balances out as our variant of concern numbers increase.
From the Canadian Press, Kelly.
A bit of a follow-up to Bart's question, but in Saskatchewan and Alberta, vaccination spots are going unfilled. At the same time, the ICU cases there are climbing. Are we seeing any indication of this trend in Manitoba in regards to both people open to getting vaccines and increasing pressure on hospitalization?
Well, I'll speak to the hospitalization. So, I mean, right now, our numbers, our overall case numbers have stayed fairly stable, although the proportion of VOCs in there is climbing. We haven't seen that significant demand on our healthcare system yet. We know as case numbers increase, then we will expect that. And so right now we're still, you know, relying on Manitobans to continue to follow public health advice. We have the aggressive case and contact management, trying to keep those numbers down. And then I'll let Dr. Reimer speak about vaccines.
Yes, so far we're getting excellent uptake for vaccination. So, if anything, I think the main frustration Manitobans are experiencing is either not being eligible or having to wait longer than they wanted for an appointment after they are eligible. And while those are obviously extremely frustrating for Manitobans, overall that's such a great problem that Manitobans are so eager to get vaccinated. So I do anticipate that we will reach a point where we start seeing hesitancy. And so I know our communications team has already started to work on a variety of different mechanisms to reach out to Manitobans to help build confidence in the vaccine. But right now, the uptake and the booking has been overwhelmingly positive. And so, I'm just really happy to see how Manitobans are coming forward to be vaccinated.
And I know that you may have spoken to this a little bit earlier, but can you give any indication of where we're seeing these variants of concern rooted? Is it largely community spread now?
Yeah, so probably the biggest proportion of those are still known contacts, and then the biggest proportion of those are household contacts. So we are seeing certainly cases that we can't link to travel or to known contacts. So that's what we would describe as community transmission. I would say that most right now continue to be known contacts.
From CTV Winnipeg, Michelle.
Hi, Dr. Reimer. I wanted to ask you, is this rare blood clot condition linked to AstraZeneca treatable at all? What do we know about that? And why are younger women the more, group that we're concerned about? Is there something about being of reproductive age, or do we even know that yet?
Yeah, so the condition, we've called it vaccine-induced prothrombotic immune thrombocytopenia, which is a huge mouthful, but basically just means vaccine immune response causing clots and low platelets. And so the treatment, there are some guidelines. Ontario has put together some guidelines that we're reviewing today in Manitoba to ensure that they make sense here as well, because there are some specific concerns that clinicians need to be aware of when they're treating it. However, it is a very serious condition that even with good treatment can still have very serious consequences. And those consequences go down if it's recognized early, which is why we're trying to share this information with clinicians right away. But it's still, even with the best care, can be very serious. So we don't know who is at highest risk at this point. Because it's specifically an immune response, that's unique from most types of clotting disorders. That's why I mentioned that people who are at risk of blood clots for other reasons, whether they have a family history or they've had blood clots in the past, they don't seem to be at higher risk than anybody else. And so we're left with a lot of questions right now about who is at highest risk. That's one of the pieces of information we're hoping to learn so that we can tailor who we offer the vaccine to once we can figure out who's not at risk of having this type of reaction. We also don't know yet if it truly is more common in women than men, or if that's an artifact of the fact that there's far more women in healthcare than there are men. And so more women are receiving vaccines in many countries compared to men because of that healthcare component. So we have a lot of questions. Like I said, we had a meeting, there were meetings last night where these discussions were happening, and we wanted to share with Manitoba what we knew right away, despite the fact that we still have many questions that we're waiting to have answered.
Thank you. I have a question for Dr. Roussin. With the variants of concern eventually becoming dominant strains, at what point should Manitobans change their behavior, like wider social distancing, shorter conversations with people? Are we there yet?
Well, I think the public health measures that are in place are, if followed, they're still going to be useful against the variants of concern. And those are just those fundamentals. And so keeping our close contacts to a minimum outside of our household. And that's the most important thing. So those prolonged indoor contact, crowded places, we need to continue to avoid. Washing our hands, staying home when ill, all these just become much more important. And then with that, we have our aggressive case and contact management, and that once this becomes the predominant strain, then we really don't. We just sort of treat every positive case as a variant of concern at some point. So. I think the fundamentals are still will still work in our benefit. The public health measures that are in place are still there for a reason. Avoiding non-essential travel is still there for a reason. And so we really are in that race against these variants of concerns and the rollout of our vaccine.
Our final reporter this afternoon from APTN, Daryl.
Hi, Dr. Reimer. In Ontario, BC, Alberta, and Saskatchewan, starting this week and going into April and moving on, Métis adults are going to be able to be eligible for the vaccine, Métis adults 18 and up. Why hasn't Manitoba prioritized Métis citizens for the vaccine just yet?
Yeah, there's been a lot of ongoing work with Manitoba Métis Federation. We haven't seen any data showing any increased risk associated with Métis people and severe outcomes related to COVID. But we want to continue to work with the MMF to identify specific barriers that they may be facing related to getting access to the vaccine. And I know that the government is eager to continue to work with their leadership as well as we move forward.
And second to that, are there any plans in the future to include Métis and Inuit citizens in Manitoba to the priority list?
Yeah, so I know that there's ongoing discussions with government officials in both of those groups to work on specific rollout plans that make the most sense for those groups. As far as the ongoing discussions, I mean they continue to develop, and we want to continue to engage to understand what are the barriers that they face, and to look at the evidence that we have in front of us. To date, we haven't seen any evidence to show that they're experiencing more severe outcomes related to COVID compared to other groups. But obviously they have a long history of experiencing a large variety of more severe health outcomes generally, including the effects of poverty, of racism, of colonization. So we really want to continue to work with them to identify how we can best help reach their citizens.
Thanks, everyone. This concludes our media briefing.